Every year, millions of seniors over 70 line up for routine health checkups thinking they're staying safe. But what if the very tests your doctor insists you need are silently putting you at risk for unnecessary surgery, stroke, or even cancer? There is a shocking truth about medical overscreening past age 70 that no one will tell you. New, bombshell research confirms, up to 37% of tests in older adults lead to complications, false positives, or treatments with zero benefit. And the worst offender, number 1 on our list, actually exposes you to so much radiation it's estimated to cause 5% of all cancers in the US. It's time to take back control. Today, we expose the 5 health checkups seniors must avoid and the terrifying truth about what they can do to your body. Welcome to Ageless Advantage. We give you the science-backed longevity secrets the system is trying to hide. This information is backed by major geriatric and medical journals, but always consult your doctor before making any decision. Let's start with a test that seems harmless, but can put you on a path to dangerous, debilitating medication. At number 5, the routine bone density scan, or DEXA scan. After 70, this quick scan can cause more fear than benefit. Bone loss is a normal part of aging. When a DEXA scan comes back showing osteopenia, mild bone loss, doctors often immediately prescribe powerful drugs like bisphosphonates. The secret? Studies show these drugs provide little to no impact on fracture rates for mild bone loss in seniors, but they do expose you to side effects like severe esophageal irritation and, yes, even jawbone necrosis, a condition where your jawbone starts to die. Don't let a mild result push you onto risky medication. The senior secret? Weight-bearing exercises like resistance bands, vitamin D, and smart nutrition reduce fractures by over 20%, far better than the drugs. But the next test can lead to something much more terrifying: unnecessary brain procedures. Coming in at number 4, the brain MRI for mild memory loss. When you misplace your keys or forget a name, the fear of dementia sets in, and doctors order a brain MRI. Here's the key truth: in people over 70, these MRIs rarely show a treatable problem. They usually just show age-related changes, things like white matter spots that are totally normal. Yet, once those spots are seen, they trigger a cascade of fear, expensive follow-ups, and sometimes invasive procedures like spinal taps or even exploratory brain surgery that don't improve memory and can make anxiety worse. One major review found that 97% of seniors who received these scans went through the emotional toll of a scary result when there was no actual disease. A simple cognitive screening test is a far cheaper, safer, and smarter first step to evaluate your brain health. Avoid the panic button MRI. Number 3 is a test you've likely had, the routine cardiac stress test. This is a common referral for seniors with mild fatigue or chest tightness. But in adults over 70, the false positive rate for a stress test can be as high as 40%. A false positive means the test says you have a blockage when you don't. This instantly funnels you into more dangerous, invasive procedures like angiograms, and can lead to unnecessary stent placement or bypass surgery. A JAMA study showed that over half of all stents placed after stress test referrals were done in patients with no real symptoms or benefit, exposing them to risks like bleeding and kidney injury from the contrast dye. If you don't have clear cardiac symptoms, a resting EKG or a coronary calcium scan is a much safer, simpler alternative to check your heart health and avoid the false alarm trap. Brace yourself for number 2, the routine colonoscopy after age 75. While life-saving for younger people, the risk-to-benefit ratio flips dramatically after 75. Why? The prep involves harsh laxatives that can cause dangerous dehydration and kidney issues in older adults. The sedation poses a high risk to brain function. And worst of all, the procedure itself can lead to serious complications like bowel perforation, a tear in your intestine that requires emergency surgery. A major Medicare study found that for every 1,000 colonoscopies done over age 75, only 2 lives were saved, but over 20 people suffered severe complications. That's a 10-to-1 risk. The official guidelines recommend stopping routine screening at 75 for most. A simple, at-home fit test is often the safer, less invasive way to screen for colon cancer risk in this age group. Don't get trapped in the colonoscopy pipeline. And finally, the most overused, most harmful checkup for seniors, number 1, the annual full-body CT scan. Marketed as a tool to catch cancer early, the truth is, these scans expose you to an enormous dose of ionizing radiation, the equivalent of up to 500 chest X-rays in one sitting. There is zero scientific evidence that scanning the whole body without symptoms saves lives. Yet, they find harmless cysts, nodules, and calcifications that force you into terrifying follow-up tests and biopsies. The kicker, a recent study revealed that the rise in unnecessary CT scans may now be responsible for up to 5% of all new cancers in the US. You heard that right, the test meant to save you might actually cause cancer. Experts, including the American College of Radiology, are clear: never use a full-body CT scan for general screening. If you have symptoms, target the scan. Otherwise, you're looking for trouble and risking your life with unnecessary radiation. Modern medicine is powerful, but sometimes less is more. Your health, time, and independence are too valuable to waste on fear-driven screening that puts you at risk. Always ask your doctor, what happens next if this test is positive? Is the risk worth the reward? Stay active, eat well, and choose your checkups wisely. If this senior secret helped you, smash the like button. Tell us in the comments, have you or a loved one regretted an unnecessary test after age 70? Share your story below. And subscribe to Ageless Advantage for more science-backed longevity tips.